Hi friends, welcome back to Complete Medical Coding, a complete CPC learning channel. Today let's learn the 80,000 series, Pathology and Laboratory. Regarding the medicine, I'll take it as a separate session in the next episode. So, Pathology, Laboratory and Medicine are the three main important chapters from the CPT codebook. In that, we will be learning Pathology and Laboratory today. And medicine, I'll be taking it as a separate session. Okay, so let's look into few guidelines of pathology. First, let's look into few guidelines about the panel codes. How will you code a panel? For example, renal panel, liver panel, hepatic function, metabolic panel, electrolyte. Like that, there are so many panels. How will you code panels together? Never give two panel codes together. We should not code two panel codes together, but give code for panel which contains more number of tests. Whichever panel is having more number of tests, you need to code that panel and then code separately for the remaining test. That's how panel test needs to be coded. Now, which are the different drug classes, drug assay? Drug procedures are divided into three subsections: presumptive drug classes, definitive drug classes, also called as DDC, and therapeutic drug class. Okay, what do you mean by presumptive drug class? Presumptive drug class are used to identify possible use or non-use of a drug or drug class. In definitive drug class, we'll do the qualitative or quantitative test in order to identify possible use or non-use of a drug. But in therapeutic, only quantitative tests are performed. Okay, and the specimen is whole blood, serum, plasma, or CSF. What is CSF? Cerebrospinal fluid. So, what do you mean by qualitative and quantitative test? In qualitative test, you will get the result only as either positive or negative. But in quantitative test, that will be a detailed description of the test. Okay. Now, check DDC listing table. Check the definitive drug. There is one table in the CPT code book called as definitive drug class listing table. You can just go through that listing table for any medicine that needs to be coded. Okay, if there is any medicine that needs to be coded, you can check in that as a reference. Just as a reference, you can use that table. Now, what do you mean by clinical pathology consultation? Clinical pathology consultation means there are 3 R. Just remember 3 R's represent a clinical pathology consultation. Okay, 3 R's represent clinical pathology consultation. Which are those 3 R's? Referral, rendering and report. It is a written report. Okay, referral, rendering and written report. What does it mean? It means a physician has ordered a lab test or referred to a laboratory for doing a lab test. Rendering, doing or performing the lab test. Written report, the report of the lab test will be in written format and will be sent back to the ordering physician. Okay, that procedure is called as clinical pathology consultation. What if a patient is directly doing a lab test without seeing the doctor? Then it will not be considered as a clinical pathology consultation. Okay, so clinical pathology consultation will be considered only if these 3 R's are present. Okay. Now, under microbiology, there are 2 identification of classes of microorganisms. That is presumptive identification and definitive identification. These 2 definitions are important. Sometimes you may get in an anatomical session. Presumptive identification of microorganisms is defined as identification by colony morphology, growth on selective media, gram stains, or up to 3 tests. For example, catalase, oxidase, indole, urease, all these tests, but up to 3 tests is considered as presumptive identification. What do you mean by definitive identification? Definitive identification of microorganisms is defined as identification to the genus or species level that requires additional tests. Apart from presumptive, additional tests are required. Okay. For example, biochemical panels, slide cultures, culture test, all those things. That's it. Now, using modifier 91, how will you use modifier 91? For repeat lab tests done on the same day. For repeat lab tests done on the same day, we will use the modifier 91. Modifier 91 itself means repeat diagnostic lab test. Now, another important point, FISH, F-I-S-H. Under cytopathology, you will encounter the word FISH, fluorescent in situ hybridization. Sometimes it can be asked in abbreviations also. Now, under surgical pathology, the type of sample is important. What type of sample that you are using? Okay. Only these are few guidelines under lab, laboratory, and pathology. Let's move to some questions, some examples, basic examples, and then I'll be taking more detailed practice questions in the upcoming session. Anyway, let's look into these practice questions as some examples. Okay. What is the code for ion binding capacity? You can go to the index page, check for ion binding capacity or check for ion. You will end up in the code 83550, ion binding capacity. Now, code for Zika virus, IgM. So, check for Zika virus, but you will get two codes, IgG and IgM. In our question, that you should be careful. IgM is the question. So, you should code for IgM. Okay. 86794. Now, surgical pathology examination gross and microscopic of breast and regional lymph nodes. Code. So, what is the CPT code for surgical pathology of breast and lymph nodes? So, go to surgical pathology and check for breast and lymph nodes. 88309. Now, next question is important one regarding the panel that we have discussed earlier. A physician orders a comprehensive metabolic panel, but also wants blood work on calcium ions and also orders a basic metabolic panel. Select the codes on how this is reported. Okay. So, here doctor orders for a comprehensive metabolic panel. He wants basic metabolic panel as well. Sorry. And also he wants the calcium ions, means ionized calcium. There are two different types of tests, total and ionized. Okay, here the doctor has ordered for ionized calcium. How will you report these CPT codes? So you have to, under the metabolic panel, under the two panels, comprehensive and basic, you should select which panel is having more number of tests and then add calcium ions. Okay. So both are same panels, only the only difference is ionized one is not present. So you need to code for the comprehensive metabolic panel and then code for the calcium ions. The answer will be 80053 and 82330. Now, fifth question. A 30-year-old female is coming in for a routine gynecological exam. A pap smear is taken from the cervix and the screening is done by an automated system under provider supervision. What lab code should be reported? So, here the patient has come for a routine pap smear test. You can directly get the pap smear code. Screening pap smear, okay, 88147. Now, code for spinal fluid pH. Spinal fluid pH, pH of the spinal fluid. Just go to pH and then take spinal fluid. You will get the answer 83986. Code for protein by refractometry. Protein. Check for protein code and then check option for protein refractometry. The answer will be 84160. Now, Lee clothing time. What is the code for Lee clothing time? Clothing time. Clothing time, answer will be 85345. Just check for the clothing time in index page. Okay. So these are few examples from the pathological session. So friends, that's all for pathology. Only few guidelines. Later we will discuss more practice questions from the previous year examination. I will be coming back soon with the practice questions. So stay tuned for more videos. If you are new to the channel, please support me and please subscribe to my channel. Thank you so much. Bye.